We all know the term bone spur. I think we've heard, oh, you've got a bone spur, or I've got a bone spur in my neck and it's pinching a nerve, or I've got a bone spur here or there. But what is a bone spur and what causes it? A technical term for bone spur is osteophyte. And really it's just an overgrowth of the bone. The ligaments that attach bone to bone, they have a connection to the bone, and there's an attachment site to the bone. At that attachment site, there's a normal strengthening of the bone because of the pressure and the tugging and pulling that the ligament's constantly doing to the bone. In the setting of arthritis, which could be thought of as a dysfunctional joint, the spine and other joints in the body respond sometimes by forming extra bone, specifically at the site where the ligament attaches to the bone. In the spine, a bone spur can grow and cause pinching of the nerve or the spinal cord, or cause a spinal stenosis. Bone spurs can form anywhere where there's a ligament attaching to a bone. So if you think about the spine, we have the annulus, which is a ligament that surrounds the disc. The annular fibers, as they attach to the vertebral body, can be a site of bone spur formation. So sometimes what looks like a bulging disc on an MRI is really bone spurring that's formed at that attachment site. The facet joint is another area. The facet joint can become larger with arthritis. There's a capsule around the facet joint, and that site can be a source of formation of bone spurs. There's a specific joint in the cervical spine called the uncovertebral joint. And this is located at the back of the disc, right where the nerve passes by, and is a very common site for bone spur formation, and is the primary area in most cases of degenerative disc problems in the neck for having a bone spur, pinching a nerve, and then having pain going down the arm. So when we go into surgery, we can remove the bone spur, clean it out, and make sure that the nerve is free. Bone spurs are not necessarily anything to be overly concerned about, but they can be a cause of symptoms. And it's a surgical problem in the sense that if the bone spur is pinching a nerve or it's pinching the spinal cord, we can go in surgically and remove the bone spur and alleviate the pressure. One question that would come up is, if we removed a bone spur, would it come back? And the answer to that question is it depends. If we've gone in and just removed the bone spur, then it might come back. Usually not, but it could. Bone spurs form in response to motion of a joint. So if we go in and remove the bone spur, but also fuse the spine, then the bone spurs would not be coming back because there's no motion anymore. Hopefully that's helpful. Bone spur, again, is just a growth of bone where a ligament attaches to it, and in spinal pathology can be a primary cause of compression of the nerve or spinal cord and result in a need for surgical correction.